listeners to our latest episode of Bridging Gap ASR-HR Conversations. I'm your host, Areeba Shakil Ahmed, and today's episode is not just a conversation. It's a crucial dialogue about a health issue affecting millions of families worldwide. We are focusing on a topic of paramount importance: vaccinate daughters to prevent cervical cancer. This episode aims to shed light on why vaccinating young girls against the HPV is a critical step in the fight against cervical cancer. Joining us today is Dr. Uzma Shamsi, Assistant Professor, Community Health Sciences at the Ahmed University Hospital. Let's embark on this informative journey together and ultimately empower ourselves with knowledge that can save lives. Thank you so much, Dr. Uzma, for joining us. To set the stage for our discussion, can you start by explaining what cervical cancer is and how prevalent it is worldwide?
Okay, thank you, Areeba. Cervical cancer is a type of cancer among women which starts in the lining of the cervix, which is the lower part of the uterus that connects with the vagina. It's a common cancer among women, and the mean age of cervical cancer is much younger compared to all other cancers that increase with increasing age. It's like mid-30s, 30 to 34 in UK. And even the pre-cancer stage starts from the age 21 onwards. So this we have to keep in mind because many potential life years are lost because of the younger age. Now, talking about the prevalence, it is globally the fourth most common cancer after breast, lung, colorectal cancer among women, right? So if we talk about the age standardized incidence rate, so it is about 13.1 per 100,000 women. But there's a large variation, right? It can be in some low risk areas, can be 3 per 100,000, but in high risk area, it is more than 70 per 100,000 women. So again, what depends is that there's a marked variation in different countries because of different sexual behaviors and accessibility to screening, treatment. So we see a lot of variation in it. And if we talk about LMC have got low middle income countries have got a lot of burden of cervical cancer. So and again, mortality is much higher. Approximately 90% of deaths occur in LMIC because of weak health system, and also we know this cancer treatment requires multidisciplinary approach, oncologists, radiation oncologists, surgeons and pathologists. So again, with the weak health system, the mortality is much higher in poor countries. Okay, if Areeba, we talk about situation in Pakistan, so exact burden is largely unknown because what is happening, we don't have a centralized cancer registry, right? We have institutional based, and those cancer registry is not very representative of the actual burden of cancer because there's a lot of underreporting. It's not a notifiable disease like other disease that we know that every cervical cancer women is registered. So estimate according to GloboCon is that there were around 11,000 new cases in 2020 and more than half died during the same year. So now we have a population, it's important to remember, we have a population of 60.6 females above the age of 15 years, and they all are at risk of cervical cancer, right? So it's a very important public health problem. And again, we have to understand we have got a very high mortality rate. Again, because of lack of awareness, stigma, embarrassment of cervical cancer, lack of accessibility, cost. So there are so many factors that when the women come to the hospital at the time of first diagnosis, it's already stage 4. So it is, has reached at the stage of not curable but incurable stage. Another reason for higher mortality in Pakistan due to cervical cancer is that we don't have any screening, early detection for cervical cancer. According to one study that was done, only 2.6% of females, they had pap smear once in a lifetime, right? So with no awareness about the disease, about its early diagnosis, so it's a matter of great concern that more than 5,000 women if dying every year. So we have to, address this neglected area.
Thank you so much, Dr. Uzma, for answering that. So moving on to the causative factors, how is cervical cancer is linked to HPV, and why is this connection significant?
Okay, first we have to understand what is human papilloma virus, right? It is a DNA virus, and there are up till now more than 200 types of DNA viruses, right? And again, this virus is sexually transmitted, which means that it can spread by person to person contact during any kind of sexual activity, right? And including touching, because it can be spread by skin to skin contact. So in their lifetime, 50% of sexually active men and women can contract any type of HPV. And now there are high risk type of HPV and there are low risk type of HPV. What do I mean by this? Low risk type like 6 and 11, they can cause genital warts, right, which is quite common STI. But the high risk, they are very important because 16 and 18, they are very oncogenic type of viruses, and they are responsible for 70% of cervical cancer. And also this HPV virus, there are other types of oncogenic high risk viruses which can even cause vaginal cancer, vulvar cancer, penile cancer, even oropharyngeal cancer. Another important point regarding HPV is that though more than 50% of men and women, are exposed to it and they get it, but most of these viruses get eliminated by the body's immune system, right? But there is a problem when they persist in the body, right, because of low immunity or other factors. And also, I would like to, for general information, add what are the risk factors for HPV. So again, it is related to the topic which is related to sexually transmitted infection, because there are certain risk factors of early onset of sexual activity or multiple sexual partners or weak immune system, unprotected sex, or even oral sex.
So examining the outcomes, has there been a noticeable impact on cervical cancer rates in regions with high HPV vaccination rates?
Dramatic effect, right? Like we start with United Kingdom. They started their program, I think, in 2007 of national immunization of HPV vaccine. So now they are coming up with the studies. There is 87% decrease in cervical cancer. Again, if we take another good example of Australia, they have done a remarkable job, and because it was a part of their national immunization vaccination program to all girls and boys, and it is implemented since 2007. So they are also now reporting 70% decrease in cervical cancer. If we talk about Europe or United States, Finland, they all have this implementation of HPV vaccine program, and they all are coming up with reduced cervical cancer in their regions. And now if we talk about even developing countries, so many countries have implemented HPV vaccine program like Bangladesh, India, Malaysia. So they are also reporting a decrease in their cervical cancer rate.
So, Dr. Uzma, focusing on prevention, why it is crucial to vaccinate young girls against HPV, and what age should this vaccination ideally start?
Again, you have seen the connection between HPV and cervical cancer. 90% cervical cancer can be eliminated by HPV vaccine. Right now, we have to vaccinate girls. This is the priority, and the ideal age is 9 to 14 years. By 15 years, they should be, before they are exposed sexually to this virus. It's important to get them vaccinated, and usually there are 2 doses 6 months apart, and this is also for boys, but right now focus is more on the girls according to the WHO cervical cancer elimination strategy, where they have requested all the countries to participate in it in 2018, and many countries have signed it also. There are currently 3 HPV vaccination for cervical cancer prevention. First is Cervix. It is bivalent, protecting against the oncogenic virus 16 and 18. Another one is quadrivalent Gardasil. It is also protecting against 4 types of viruses, which include genital warts. And then latest, which is used in United States of America, it is 9-valent. It is protecting against 9 types of HPV virus. So they are not only protecting against cervical cancer, pre-cancer lesions, but also genital warts. And they all are licensed, they are all very safe. And with these 3 vaccines, at least there's another 4th one in China also, but now every citizen, every person has the right to get their daughters vaccinated when we have a vaccine for cancer prevention, because if there's a vaccine for breast cancer prevention, won't we go for it instead of screening? So when there's a vaccine, I'm sure that this vaccine is an awesome discovery by humans and their hard work.
Right. So a topic of much debate is vaccine safety. How safe and effective is the HPV vaccine?
Okay, so it works extremely well, right? It is protective against, like I said, HPV virus types. There are many virus types, at least 9 types of viruses that it is protecting. It is effective. And data from clinical trials that I can see is that there are many clinical trials done, and even initial post-marketing surveillance has been conducted in several continents, and they all show that all 3 vaccines are very safe. Right? There are certain common side effects, like, at the site of injection, you have mild tenderness or redness or swelling. It goes away. And even if there's a fever for 1 or 2, but up till now, in spite of its introduction since 2007, there hasn't been any long-term or short-term side effects that has been documented. I must also share that protection provided by HPV vaccine lasts a long time. So people who received HPV vaccine were followed for at least 12 years. And their protection against HPV has remained high with no evidence of decreasing over time. So again, I will emphasize, I'm a very strong advocate for this vaccine and the cervical cancer prevention program, especially in a country like Pakistan, where women are dying due to late diagnosis, lack of screening facilities. Why to suffer when we have got a preventable cancer vaccine?
Mm-hmm. Correct. So let's address some misinformation, and I would like to ask that what are some common myths or misconceptions about the HPV vaccine and how they can be effectively addressed?
Okay, Areeba, we know the recent 2009 pandemic, right? And there was a term we used, vaccine hesitancy, right? And WHO in 2019 declared that vaccine hesitancy is one of the top threats to global health. Right? So again, there were a lot of hesitancy, a lot of concerns. Same goes with it. There are a lot of myths, misinformation. Common myth, it can cause infertility. The fact is other way around, because if you don't have this vaccine and you develop, for God forbid, cervical cancer, then you may lose your fertility and lose your womb uterus. So again, we have to understand that what are the myths with every vaccine, especially these are school-going girls, right? It's a very vulnerable and sensitive age. So parents are concerned. They are concerned about how safe it is. Right? And there are myths that it has many side effects. There are sometimes very strange kind of myths. So as we are some of the journals in West showed that they were concerned that it is increasing promiscuity among girls. So, these kind of misinformation and concern about side effects, we have to address it, and it will remain until we address them, we clarify all the myths, we share all the information regarding its safety and its benefits.
All right, so looking at the global landscape, is there a disparity in the access to HPV vaccine globally? I'll definitely talk about Pakistan as well, and definitely ask you about Pakistan. So how does this impact fight against cervical cancer?
That's a very important question. Again, we have to understand that in 2018, WHO issued a call to action towards global cervical cancer elimination, with a global target of 90% of girls, school-going girls, being vaccinated with this vaccine by the age of 15 years, right? So all countries have made this commitment with WHO. And if we see, 1/3 of high-income countries are already having this national immunization program and HPV vaccination. Mostly they have started in 2007. And they have school-based implementation strategies as well as opportunistic, when mothers or parents can go to the clinics or gynecological clinics or pediatric clinics and ask for the information and get their daughters vaccinated. Actually, Australia is a very good example, right? It is the first country that is on the track to achieve this target of WHO and eliminate cervical cancer by 2035 through their national immunization program. And they are, providing free of cost vaccine, and they are providing to both girls and boys by, of age 9 to 14 years. And it is since 2017. So this is a very good example that we can see. Talking about low income countries, there are certain countries like Tanzania, Kenya, Uganda, and they have introduced it with Gavi, the Vaccine Alliance, and they are also having this HPV vaccination in place. And it is usually available at doctors' offices, community health clinics, primary health clinics, even school health services, so and health departments globally. Now, if we talk about Pakistan, do you want to know what's happening?
Yeah, for sure.
So currently, the sad situation is we don't have any vaccine, any of the 3 vaccine available, even if someone wants to vaccinate their daughter. So actually, a few years ago, there was a rollout of HPV vaccine, but we don't have data. What was the reason of poor uptake? But it seems that it was cost, lack of information, lack of awareness. So these were the factors that right now we don't have any. The government of Pakistan is moving forward, and we had a symposium in Islamabad. It was in collaboration with WHO and Gavi and even UNICEF and Gates Foundation, and they are very keen to introduce this vaccine in Pakistan. Rather, I would say reintroduce in Pakistan, because we don't know what happened, what was the actual data, how many were vaccinated. But I think it's very important that in the presence of HPV vaccine, no women now should die of cervical cancer.
Right. Thank you so much for answering that question. So, considering the family's role, what should parents or guardians know about the HPV vaccine? How they can be encouraged to vaccinate their daughters?
So again, it's very important to win the confidence of parents, and not only mothers but also the fathers, because they are the decision makers. And again, awareness, right? Dispel all the myths, all the misinformation. It can be through mass media, it can be through educational campaigns, it can be through community efforts, through volunteer organizations in collaboration with government and non-government organizations. And it's very important because it's a very sensitive topic, right? Sexually transmitted infection. So we have to be very careful about our cultural context. We are a conservative society. So instead of saying that it's a STI vaccine, why not say it's a cancer vaccine? These are small points, but they are important to address, because there are certain culturally sensitive and conservative matters that we need to respect. And again, much can be done to win the confidence of parents.
So, looking ahead, what does the future look like in terms of cervical cancer prevention? Are there any new developments or research we should be looking forward to?
I think in cancer research, the future is filled with hope and promise. We have seen so many breakthrough achievements, progress in the survival of cancers, especially this HPV vaccine, is a outcome of countless efforts by scientists. So I am reminded of Iqbal phrase, उरूज आदम खाकी से अंजुम सहमे जाते हैं कि ये टूटा हुआ तारा महे कामिल ना बन जाए. So man has made groundbreaking advancement in cancer research and treatment and all cancers, especially cervical cancer. So there are many exciting new developments. Even if you just see, there is undergoing clinical trial to see the efficacy of a single dose HPV vaccine, instead of 2 doses, because compliance is affected. The second dose after 6 months, sometimes it is missed, and then they are working on so many cancer biomarkers in cervical cancer for early detection, and we don't know what they come up with. Within a few years, the amount of research and the work is being carried out. So and also important is that we have now entered a very exciting era of omics, like genomics, proteomics, and precision medicine according to everyone has a unique genetic makeup. So, tailored according to the person's treatment and what is required according to unique genetic makeup. So, again, this is a very exciting time. Future is for cervical cancer elimination.
So, lastly, a crucial question for our listeners, and this is our last question. So, what can you do to spread awareness and support the cause of preventing cervical cancer through vaccination?
So again, in summary, we have to spread this message of HPV vaccine for cervical cancer. It is a preventable cancer, because yet millions of women are dying around the world and they are still being diagnosed with cancer. So this is time call for action for increasing the campaigns, like this podcast is very important, other media and other methods of communication. I must quote here that share this. There was a very famous UK celebrity. Her name was Jade Goody, and it was in I think which she was working in a big show, and she was at the top of her career, and she was suddenly in the middle of a show, she was called by the doctor and she was told that you have got stage 4 cervical cancer, and she was only 27. So during the small time that was left with her, she raised a lot of awareness, because she was a patient suffering with cancer and she was diagnosed late, and that was called Jade Goody effect, because there was an increase in the pap smear cervical screening. So if we like in these podcasts also bring cervical cancer survivors, because they are undergoing so painful treatment, right? And they know that prevention is so much better, cost effective than this chemotherapy, and extensive surgery sometimes is required if you even have to remove the lower part of anal canal or urethra, and then you have a stoma bag. So they can be very good advocates, because in summary it's very important to understand that we have to join hands as a team of healthcare professionals, cancer survivors, their caregivers, politicians, policymakers. We have to join hands and try our best to fight for a future free from cervical cancer.
Right. Thank you so much, Dr. Uzma, for all these answers. I hope these answers are very helpful for our audience. So moving on to our last part of our show is a rapid fire round for you, Dr. Uzma. So are you ready?
Yep.
So you will get only 10 seconds to answer. So let's begin. Girls or boys?
Girls.
School program or clinic visit?
Both are important.
Side effects or benefits?
Benefits, of course.
Mandatory or optional?
Mandatory, of course.
Early or late vaccination?
Early.
Parents' consent or autonomy?
Parents' consent.
Awareness campaigns or personal advice?
Awareness campaigns.
Government funding or private expense?
Both.
Global initiative or local efforts?
Both are important.
Regular checkups or vaccine reliance?
Vaccine. Though again, I must say that vaccine does not say that you don't need to go for screening. Screening, which is another important topic for earlier diagnosis of cervical cancer, which I'm sure you are going to cover in another podcast. So screening remains there every 5 years or every 3 years, depending on the case.
Single dose or double dose?
Single is very good for us, better.
Thank you so much, Dr. Uzma, for being on the show. It was lovely having you. As we wrap up episode 5 of our podcast, I want to thank you for joining us on this deeply informative and essential journey. Remember, knowledge is power and awareness is the first step towards change. We encourage you to spread the word, support vaccination initiatives, and engage in conversations that can lead to action. Together, we can make a significant impact in the fight against cervical cancer. Thank you for listening and stay tuned for more episodes where we continue to delve into topics that matter and make a difference in our world. Until then, I'm Areeba Ahmed, and this is the Bridging the Gap ASRHR Conversations. Take care.